Neuropsychiatry is a branch of psychiatry that is basically dealing with the diseases of the central nervous system. So we'll be discussing these brain diseases over here in this very first section. So there is a range of variants available that is regarding these diseases that are relating to the neuropsychiatry, ranging from the Huntington's chorea, then we have the Tourette syndrome, we have the epileptic diseases, and we can have the significant seizural disorders that are not even related to the epilepsy, that can also relate to the disorders of the neuropsychiatry. So we'll be discussing them over here in this section. When we define epilepsy, epilepsy is basically a disorder of the central nervous system in which the person has seizures and they're not related to any traumatizing event that took place in the recent past, or it is not even related to any medical manifestations that the person is going on through. So these seizural disorders are regarded as epileptic seizures, or they're regarded as to be, the person is regarded or diagnosed as having epilepsy. So we'll be discussing that over here as well. Then there are certain symptoms that are related to these neurological diseases. We'll be discussing them as well. First of all, the definition that is regarding to these brain diseases, we'll be discussing that, and how do we basically differentiate between the psychiatric disorders and the disorders that are related to the brain diseases, or that are related to the focal brain diseases, any condition that is arising due to the disorders or abnormalities in the central nervous system is regarded as to be the disorder relating to the neuropsychiatry. So we'll be discussing the prevalence of these diseases, why are they so prevalent, what are the causative factors, and then the particular clinical presentation to distinguish these focal or the neurological disorders from the psychotic symptoms is again very important when you're practicing as a psychiatrist. The clinical presentations of these disorders will also be discussed over here in this very first section. So how do we go about and define this neuropsychiatry? Neuropsychiatry concerns the conditions in which the mental disorders results from demonstrable structure or neurophysiological disturbances of the brain. So it can be any focal lesion of the brain, a lesion that is involving the central or the peripheral nervous system will be regarded as to be classified as a disease of the neuropsychiatry or a disease of the central nervous system. And then there can be some neurophysiological disturbances that basically regards to the biochemical disturbances in the brain that can even affect the functioning of the brain of the individual. The disorders that straddle between the boundaries of neurology and psychiatry is again very important over here. It's the psychiatric symptoms at one hand. So we have to distinguish between the psychotic symptoms and the symptoms that are related to the focal lesions of the brain. It's again very important to distinguish between these two. The treatment guidelines of these two disorders are quite distinguishable, and so mostly the psychiatric disorders are treatable by the cognitive behavioral therapies or by the counseling sessions. Medications are not needed mostly for the psychiatric or the psychotic symptoms until and unless they are of the extreme level or they are of the severe level. So when we deal about the neurology or the disorders that are related to the neurological disorders, usually the medications are coupled with the surgical procedures. And that is how the outcome is quite significant in both of these two disorders. Now, the prevalent diseases that are regarding or that are added on or classified as the neurological diseases are the Parkinson's disease, then we have the Huntington's disease or the Huntington's chorea, and then we have the Tourette syndrome that is characterized by the tics and seizures, but the seizures are of much lesser duration than the epileptic seizures. Now, how do we basically differentiate between the Tourette syndrome and the epileptic seizures is again very important. Epileptic seizures can be just the the comprehensive seizure in which there is an increased electrical brain activity. And on other hand, it can be an abnormal behavior. It can be the stoppage of the thinking process. The person basically has abnormal sensations or abnormal behavior during the seizure period. There is a preictal phase that is characterized by the symptoms of aura. Then we have the ictal phase in which the person usually has the seizural disorder, and then we have the the postictal phase, in which the person also behaves abnormally, or the thought process or the thought content is affected during the postictal phase. So this is the differentiating features between these range of disorders over here, and these are the most prevalent diseases that are relating to the branch of the neuropsychiatry. So when we regard the clinical presentation of these neuropsychiatric disorders, the personality and the behavioral changes are very significant. During these focal neurological disorders, the cognitive impairment and the confusional states are also observed in these individuals. There is an affective disturbances that is also observed in these individuals as well. Then there can be the symptoms of psychosis also observed in these individuals. The mood disorders are going to be there. It can be the bipolar affective disorders ranging from depression as well as symptoms of mania or observed in these individuals, and the psychotic symptoms can range from the delusions, the hallucinations, or the firm beliefs can be observed in these people who are suffering from the neurological disorders. So the features suggesting the organic disorders, they include the fluctuating symptoms. So the clinical presentations, which usually fluctuate from person to person, and even in a single person, they'll fluctuate from time to time. Then we'll have the localized cognitive defects. They're associated with the neurological diseases in these individuals. There is going to be a vague and paranoid delusional defects. The paranoias are going to be of the persecutory type in these individuals, and the delusions are going to be the firm beliefs that are kept by the individual, or that is kept by the patient who's suffering from the neurological disorders. Olfactory or visual hallucinations are also experienced by these individuals. Then we have the atypical symptoms of the functional disorders that is observed quite commonly in these individuals. The record of cognitive disorders before the other symptoms is quite significant in these individuals as well. The focal disorders, when we talk about them, they range from the personality and the behavioral changes that are observed in the frontal lobe injuries, as well as the catastrophic reactions are also observed in these individuals with focal or the frontal lobe injuries. Depression and anxiety is one of the feature as well. There's an increased risk of suicide after the traumatic brain injury. So this has also been done through the repeated researches that have been carried out at different intervals of time. Punch drunk syndrome, that is usually characterized in the boxers, and then we have the vascular dementia. We have the chronic cognitive impairment also seen in these individuals having subjected to trauma. Bipolar affective disorders, psychosis after the temporal lobe injuries. So these are the disorders in which the different lobes of the brain are affected, and they have their psychotic symptoms or psychiatric symptoms are manifested in these individuals at some interval in their lifetime. So over here, we gave a preview regarding the neurological disorders that are quite prevalent, ranging from the Huntington's disease, Tourette's, or epilepsy that is quite prevalent epidemiologically. So that is the end of this section. Thank you for watching sqadia.com.